Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy
Hey
the
everybody,
show.
I'm Dr. Nick Circolone. You're listening to Health Chat. I'm so excited to be here, as always. Well, tonight we're going to talk about groin pain and some things that cause groin pain and some things that can be helped and some things that can't be helped. First, we want to start with groin pain is in the anterior part of the body, down there by the hip. A lot of people think, oh, my hip hurts, and they keep pointing to the back. Well, that's not your hip. Your hip is usually in the front. Well, with groin pain, it could be coming from your low back. It could be coming from the sacral area or the SI joint, and it could be coming from the front area, which is known as the psoas muscle or iliopsoas muscle, which will cause some of that pain. And a lot of times people have this kind of shooting pain into the groin area, and they're like, I don't know what's causing this. Now we have to have that evaluated to make sure it's nothing more serious that's an internal organ causing more of the problems. But a lot of times it's musculoskeletal and it's an easy fix with manipulative therapy. Well, I'll tell you, it's uncomfortable and extremely painful and extremely annoying. Some people get what's known as a catching hip or this snap that's in there, and that's called an iliopsoas snap. Now, sometimes that is just because we sit for long periods of time, we don't get up, we don't stretch, and it causes that kind of pain. Sometimes we have degenerative disc disease or degenerative joint disease in the back, which causes some of that as well. And that pain will come around, go into the groin area. Sometimes it'll go down into the leg and into the right into the knee, but usually not past the knee. Well, let me tell you, it is so annoying. It drives people crazy. Now, they'll go see their family doctor, they'll go see the orthopedist, and you're like, I don't know what it is. Sometimes you'll get shots in it, it'll feel better, but it'll keep coming back. Well, what happens is it's a misalignment of that area or a asymmetric movement of the muscle and joint together. Well, once we can get it cleared up, we feel better. So how does this happen? How do people get this hip pain, groin pain kind of thing? Well, from a lot of things. Well, most of the time, it's because we're inactive. It's usually a misalignment of the pelvis, the sacrum, and the lumbar spine. If they don't function properly, you're going to get that kind of pain. Not only that, but the iliopsoas muscle is implicated in this tendon snapping. And that, the only way we can fix that is to stretch that out and to build up our core. The more we build up our core, the better we're not only going to feel, but the better those muscles will be stretched and they'll be stronger. That way they can support that area and you won't have a lot of this pain. But I will tell you, I've seen patients over the years, wow, I've been practicing almost 30 years now. We've been seeing patients with pain like this that resolves pretty quickly. Within, I don't know, probably 3 to 4 visits, boom, they feel much better. As long as it's not a problem that is caused by something that's a little bit more serious, such as a bulging disc or a facet arthrosis, which means arthritis, that is causing some of this pain, or they definitely have a degenerating hip. With a degenerating hip, we can make you feel better, but we're not going to get rid of the degeneration. By the way, I've been asked this before. Can I get rid of the degeneration? Because a lot of people feel better after they get adjusted. The answer to that question is no. But what we can do is we can slow it down so it doesn't keep progressing as quickly as it was, but it's still a progressive disorder, and we will progressively go to that area. But we could slow it down with manipulative therapy. You can also slow it down with exercise and with doing stretches and such as yoga or Pilates. Again, I'm not a big Pilates fan. Every time I do Pilates, I hurt something. There's something about Pilates that I just can't do as well as some other people. But I can still do yoga. I can still do other stretching techniques that do make me feel better. But Pilates, just not one of my favorites. And if it's not one of your favorites, find something that you like to do and you'll continue to do it. So the hip can be dealt with chiropractic care, manipulative therapy, stretching, and some other modalities to decrease that pain. And again, if it's something that's musculoskeletal, it's usually a quick fix. It usually goes away relatively quickly, and sometimes it comes as fast. You know, there are times you'll be walking down the street, you'll step off the curb the wrong way, you may come down and step the wrong way, you may be doing some gardening and step into a hole, and it throws you into this chronic kind of pain, into the groin, and it seems like it's the hip, but it may not necessarily be your hip. Once we evaluate that, once we find out it's not the hip, and we find out it's more muscle and more of the tendons that are involved, it's an easy fix. So guys, have a great day. Enjoy the week. Have fun. We love you, and we'll see you next week.